Hi, my name is Jane Fonda and I've been a sonographer for 40 plus years, so quite a while now. Well, I have worked in clinical work, I've worked in hospitals, I've worked in private practice and also taught at university, and I'm still teaching at university, but I more or less am, I suppose you could say, semi-retired, so now I'm doing a little bit of other things as well, which is really good, yeah. Oh, I first came to Vision College quite a while ago. I can't remember exactly, but it'll be nearly 10 years ago. And it was to teach. It was really good. It's changed, it's expanded. The next time I came, it was to assess students, and now I'm here again to assess students this time, and I can see how much the college has grown in that time. It's been great, yeah. Amazing.
Amazing.
Yes.
Thank you.
Well, I started my career as a radiographer, and I heard about ultrasound. I didn't know what it was, but I'd heard about it, and then I worked with a lady who had a friend who was working in ultrasound, and then when the opportunity came, it came about quite incidentally. Where I was working was at St Margaret's Hospital in Sydney, and Sister Anne, she was one of the Josephite nuns. She asked me would I like to start the department there, and I went yes, but I don't know what it's all about. So I went over to Paddington Hospital to learn, and there they had the first ultrasound machine that was put into a hospital placement. Dr. Bill Garrett was the director, and George Kossoff was in charge of the Ultrasonics Institute, and those two worked really well together to develop the equipment. And so I started on the prototype machines, not the commercial machines, so the old lab-based equipment, and that's where I learned. And then we bought an Octason for St Margaret's, and it was an Australian-made machine. It was brilliant. It was so good because what it did was, being a radiographer, you had one aspect of patients. Being a sonographer, you got the grayscale, you got the soft tissue imaging. So it was really like opening a new window for me in my career. It was fantastic. It was just different. So it really started a whole new learning curve for me, but one that I've continued in all these 40 years. I'm still learning. There's great opportunities for sonographers. Being dedicated is one thing, showing that you're committed to it. What it does is it opens up windows for not just imaging, but the clinical aspects of medicine, which has been really interesting for me. So yeah, I think the opportunities for sonographers, there's a shortage in Australia, and I'm sure there's probably a shortage here in most countries because you know, you're training students, so hopefully they've got placements to go to, and that. There's always plenty of work out there. Sonography is, yeah, it's been a really good career path for me, so I hope it is for the future generations of sonographers. Oh, memorable experiences. I've met a lot of people in my travels. When I first started, I was also teaching at the TAFE, and they ran a course in Sydney, and we used to get guest lecturers coming over, and if I was travelling, then I let them know, and they'd say come and have a look at the hospital. And I went with my husband to San Francisco one time, and I went and stayed with, met Fay Lang at the hospital, and she was showing me a uterus with fluid in it and an ectopic pregnancy, and it was a pseudo sac, and I happened to have a picture of one that I'd already taken, and she's going, oh, you know. So it was really not, it's that sharing of ideas or that sharing of the knowledge that was really, really, I think that's what got me more impassioned about being a sonographer, is the fact that we were communicating with each other, doctors and sonographers, and yeah, it's just been a really rewarding field that way. Just be open-minded to learning, that's it. You know, just being able to sort of take it slowly, but being able to relate to what you're seeing on the screen. It takes a lot of practice. It takes a long time to actually get fluent in being able to move that probe, knowing that what you're looking at is anatomical on the inside. You're not relating it to the surface, you're relating it to internal anatomy. And that takes a while to understand. Don't get discouraged, just keep persevering, but always being able to apply what you learn to a clinical context as well, so that you're actually benefiting the patient. Yeah.